is Nancy. I'm going to be doing your physical assessment this morning.
Okay.
How are you feeling?
I'm doing well, thank you.
Okay. What brought you to the clinic today?
Just a checkup.
Just for a routine thing. I've not ever done a physical assessment on a doctor before. It's a little intimidating.
I'll think it'll be fine.
Okay. All right. Tell me your name.
Stacy Ritchie.
And where are you?
I am at BCTC clinic.
Okay. And what day is it?
Today is August 19th, I believe, 2020.
So I'm looking at Dr. Ritchie, and I'm looking at her whole thing, and I'm looking really just for a general survey is what we call it. She seems to be symmetrical on both sides. She's answering my questions appropriately. She seems calm. She's oriented ×3. She's clean, well kept, well dressed, so that's a good start. Let's see, what did you have for breakfast this morning?
I had some toast with peanut butter and half a banana on it.
Okay, and who's the president?
Donald Trump.
Okay, and where did you go to school, to high school?
I went to Johnson Central in Paintsville, Kentucky.
Okay, so that's just a little testing of short and long-term memory, asking about that. Are you having any pain anywhere?
No, not currently.
Okay, all right. I'm gonna get some gloves and put them on. And let's see, one of the things I have to do is determine her developmental stage, and I'd say, I don't know exactly how old she is, but I'm gonna say probably it's between 45 and 65, which would be the generativity versus stagnation. I guess I'll do this first while you're sitting up and you have your shoes on. Do you use any assistive devices?
I
To
do not.
walk or a cane or anything like that? I see you wear glasses all the time. Could you get up and walk for me and just walk over there and then turn around and come back? So while I'm watching her walk, and I can do this before, at the end or at the beginning, she's got good balance. Her arms are not swaying wildly, but it looks like they're doing the appropriate opposite arm and leg. You can go ahead and sit down.
Okay.
She isn't limping, and she seems like she's got good balance. And while she's standing up, I could ask her to close her eyes and just stand and see if she sways any, but she looked like she was in good control here, symmetrical in that way, okay? While I'm looking at you, I'm gonna ask you if you to turn your head to side, okay? And how about putting your ear to your shoulder? So she's got range of motion in her neck, and it's holding up her head okay. We might as well do this while we're at it. Can you lift your arms? I've got her walking, but I have her lifting her arms. How about out this way? So she's got regular, at least basic range of motion. Any problems with your joints?
No.
At any time, any walk? Okay. All right. So I think at this point I'm going to start. I'm going to have to touch you a little bit in order to do this physical assessment. I'm looking at her hair. It's clean and shiny and well kept. She's got earrings in her ears, okay, at this point. But any falls lately?
No.
Okay. So I'm going to check her scalp for any bumps, any bruises, any pain in your hair and head at all?
No.
Okay. Feeling all around. I'm going to look at the back of her neck, just looking for any nits or lice that might be on the hairline. Any problem with any troublesome little parasites?
No.
Okay, that's good, isn't it?
Yes.
That's good. All right. While I'm here, I'm going to look at her ear on this side, and I'm going to look, and I'm going to see that the top of her ear is on a same, not parallel, so, right off to the top of the outer canthus of her eye, and her ear turns around. Any problems with your ears at all?
No.
Any drainage?
No.
Okay. And I'm going to do the same thing on this side. Okay. And I'll pull out my pen light in a minute, which I have here. And I'm going to look in your ears. Okay. So I'm not seeing any drainage. Looks good. Not seeing any buildup of wax. Looks good over here. All right. Would you take your glasses off for me, please? And so we're gonna do this demonstration, and Miss Ritchie's gonna take her mask off so we can show you what the steps are to doing the mouth and things like that. So if you would take your mask off, we'll do that. I'm gonna check your eyes first. I'm gonna shine a light in them. If you look straight forward and look at me, it's a little bit hard to see in here because the lights are so bright, but I'm looking for her constriction of her pupils, and I do see that they do constrict a tiny little bit. You really should turn the lights down so that you can see that. The other thing I'm gonna ask you to do is I'm gonna ask you to look at the tip of this, and I'm gonna ask you to focus on that while I bring it closer. And I'm watching to see if her eyes get cross-eyed, basically, and that's accommodation, okay? So her pupils are equal, round, reactive to light and accommodation, so that's Perla. The other thing I'm gonna do with her eyes is I'm gonna pull her lower lids down so that I can see her mucous membranes, and those look pink, okay? I'm gonna look at her nose, it's symmetrical. Do you have any problems breathing or any problems with your nose at all? Deviated septum, anything like that?
I did have it one time, and it was surgically corrected.
Okay. Can you put your finger on one side and breathe in? And then on the other side? Any problem with airflow today?
No.
Okay. I'm going to look in her nose, and I'm going to see that her nose is clean. You might have a problem with a little postnasal drip, too. It's allergy season.
Mm-hmm.
Okay. I'm looking at her mouth. Could you smile for me? Okay. And then how about stick your tongue out? So open your mouth and stick your tongue out. Stick your tongue out all the way. So I'm looking at her mouth to see if the facial, that's good, thank you. See if it's symmetrical when she does those motions. That's part of a neurological assessment. The eyes and the mouth movements and the movements and how she controls her head, all part of the neurological assessment. Hearing as well, and we'll get to that in a minute. So if you could open your eyes for me, open your mouth for me. Stick your tongue out, say ah.
Ah.
Okay. And I'm looking at her teeth. She looks like she has good dentition. I'm looking at her mucous membranes. They're pink and doing okay. Stick your tongue out again. I'm looking at her soft palate and say ah.
Ah.
And I can see her soft palate in the back, which looks good. I can't see her tonsils. Do you have your tonsils?
Yeah.
Okay. Hard to see them.
Mm-hmm.
Hard palate looked okay too. So her mouth looks good in terms of that. So while I'm doing this, I don't need this anymore, I can't remember. While I'm doing this, I'm also going to be testing her pulses. And I have to say now, for when you do your check-off, you can do your pulses all at once, or you can do them as you go down the body. It doesn't make any difference as long as you remember to get them. So we'll do her temporal pulse. Okay, that's equal. I'm going to do her carotid, one at a time. Okay. I'm also going to be checking her lymph nodes. We'll do the ones in front of the ear, the ones behind the ear, down the neck. Any problems or pains with your lymph nodes?
No.
Ones underneath here. Okay. We can do down. Excuse me, I have to move your pearls. Okay. Do the ones here. And when I do this, I'm doing it with the pad of my fingers and just making little circular motions. And it's hard to find any lumps unless they're pretty big. So that's the good part of her neck, and so that's her lymph nodes. Okay. Hair, eyes, ears, except for the Whistler test, nose, mouth. Check for balance. Okay. All right, I'm going to move down to her neck. I'm looking at her shoulders. Now, I also have to do the skin. Yeah, put that back on. I also have to do the skin, and you can do that as all one, pretend it's all one body part, or you can do that as you go. So right now, I'm just looking at her arms or forearms, asking her if she has any open skin areas, rashes on your skin. I notice you have a little bit of a scar up at the top on your chest. Does that go all the way down?
Yeah, it's about maybe 8 inches long.
Okay.
Medius sternotomy scar.
I don't know when you had it done, but it's healed really well.
Yeah.
Yeah, that's good. So I'm looking at this. I'm going to be checking both her radial pulses. if I had to take her watch
That'd
off,
be
I
okay.
would.
Can if you like.
That's okay, I'm good. And then I would check her brachial pulse on both sides. Okay. Okay. And, let's see, along with the skin, the things I would check would be, I would check her skin turgor, and she's still a really young person, so she's got good turgor. If she was an older person, I would check under the scapula, because as we get older, we do have a tendency to maintain tinting for longer than a young person. I'm looking at overall color. I'm looking at temperature, which I do with the back of my hand. I'm looking at moisture level, which looks good. I'm looking at her hands, and I'm going to look at both of them, and I'm going to look at her fingers, her fingernails, which are clean and filed well. I'm going to test for capillary refill, which is brisk at under 2 seconds. And I'm going to do that on both sides. Ever had your palm read?
No, can you do that too?
No. Nope, the thought just came to me while I was doing this. Okay, so, all right, so I've got my stethoscope, and I need to do her heart assessment and her breathing assessment, which I'll do next. So I'm going to ask you just to take a breath and breathe in and then breathe out, and I'm going to be moving my stethoscope. I have to do it and listen to a full breath cycle all the way around when I do the breathing. First, I'm going to do the heart, though. Let me scoot these over here. So I'll warm the stethoscope. So I'm looking at doing it here with the aortic. Pulmonic. I'm going to do Erb's point here. And then I'm going to do the tricuspid. And then I'm going to do the mitral under here. And for someone, I'm not going to do it here, but I would lift up her breast so that I could put it under there and listen to it very carefully. Okay. And I should hear the S1 sound at the apex of the heart or down at the bottom, and the S2 sound over here of the lub dubs. Okay. So now I'm going to listen to your breathing. If you would take a deep breath and let it out. Again. 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 If you get dizzy at any time, you can stop and let me know. Again. Again. And I'm going to do underneath her breast and over here. And I'm going to hold up her arm and do it over here and over here. Okay. So at least on the front so far, her breath sounds are equal and bilateral. I'm going to go around to the back. And once again, on the back side, I'm looking for symmetry. Can you lean forward for me? So I'm looking for any problems with the curvature of her spine, and this looks like it's within normal limits. She has no kyphosis, no lordosis, no scoliosis, so she's good there. Okay, you can stand up, please. Now I'm going to ask you to do the same thing, and I would do this against her bare skin, right? We have to do our breathing against her bare skin. And here I'm going to do breath in. Can you breathe a little deeper? Good. It's hard to hear through the sweater. And then I'm going to do an arrow, sort of an hourglass shape, and come and avoid the scapula here. Breathe in, and avoid putting it on the vertebrae as well. Again, again. Well, and again, you know, one of the reasons I'm not hearing it is probably because I need to put the ear things on. Again. There, that's better. I wonder why she doesn't have any breath sound. Don't make that mistake. One more time. Yeah. Again. Okay, you're good, thank you. I would be looking at the skin on the back, especially if she's an older person. We want to make sure that, depending on where she's coming from, whether it's a long-term care facility or even from a home, if she's older, you need to check and make sure that she doesn't have any broken skin areas here. Okay. And the last thing I'm going to do on back here is I'm going to whisper a 2-syllable word, and I want you to tell me what it is, okay?
You're going to say that again.
Blackboard.
Okay, blackboard.
Okay. Yeah, we got these masks on it. let's see,
Tablecloth.
okay. So I've done her whisper test, and that finishes up her ears. Okay, I think I'm done with the back. I'm looking at the skin, okay. Excuse me. Okay, if you don't mind, I'm gonna ask you to lie down here. Oh, do you need to empty your bladder first?
No, I think I'm okay.
Can you lie flat without any problems?
Yes.
Okay, all right. So now I'm gonna do her abdominal assessment, and we would wanna do this looking at the bare skin, but I'm not gonna do that to Dr. Ritchie. But we could, all right, and we should if we're doing it on a patient. So I'm looking at the contour of her abdomen. It's rounded, and so far it looks soft. And I'm gonna find her umbilicus underneath her pants here, and then I'm gonna divide, am I close?
Yeah.
Okay, I'm gonna divide into 4 quadrants this way, and I'm gonna put on my stethoscope. And I'm gonna listen to each of the 4 quadrants, oh, sorry. Did you eat lunch?
Yes.
Okay. So I do it this way. I start at the lower right. You listen to, you hear a couple of the tinkling sounds. Okay. Okay. So I've inspected, I've auscultated, and she has bowel sounds in each quadrant. And then I'm going to palpate. And you can palpate differently, but I kind of like to palpate and say, if you have any tenderness, please tell me. Okay? I'm going to use the pads of my fingers, not the points. And some people do this with one hand. I like to do it with 2. And you're just using a gentle, soft, gentle rounding motion. Okay? Any pain?
No.
With any of the pressure? Okay. Do you have any problems with your digestive system?
No.
Any problems with gastric reflux, constipation, diarrhea?
No.
Any change in your stools?
No.
Okay. Recently, okay. And then I'm also going to listen for a bruit for her aorta and for her renal arteries. You could do this on the back as well. So just a little bit below the sternum. And I'll be listening for a regular, repetitious swishing sound. And I shouldn't hear any. And then I'm going to think about where her kidneys are on the flank. Okay, so where her kidneys would be, and listen on either side. Okay. And so she has no bruit or noise at all. It would be indication of any occlusion of the vessels that are carrying blood to the kidneys and further down the body. So normal it's a negative finding. Okay, just a minute ago I thought of something I forgot before. What was it? Oh, and while she's lying down and we're in this area, I'm going to ask about her. I asked her about her bowel movements. When was your last bowel movement?
This morning.
Okay. Any problems with voiding? Any pain or burning on urination?
No.
Okay. Do you do self-breast exams?
Yes.
Okay. When was the last time, and how often do you do them?
Monthly. The last time was probably about a week ago.
Okay. Notice any changes, shapes in the shape of your breast, bumps anywhere, changes in the condition of your nipples, any of those things? Okay. So I would ask her that as well. Okay. And any hemorrhoids?
No.
Okay. So we'll get all those things done together. Already talked about looking at the abdomen, so that would include the skin assessment. And of course, if I were looking, I would note her scar and the shape and the healing, since she said she had her surgery a few months ago.
In March.
March, yeah. Okay. So I'm looking at her legs now. I'm going to move down here. I've got her GU, in her abdomen. I'm looking at her legs. Of course, I'm going to look at both. I'm going to look at the skin texture on both. While I'm doing my pulses, if I would do them appropriately, and I would do her femoral pulse on either side. You can do those together. Begin a blood flow. And then I'm looking at her legs. I'm looking at her skin distribution to make sure that's it's evenly distributed. I'm looking at the temperature of her legs. I'm going to take a shoe off, okay?
Toes are a mess.
We won't tell. So her feet look good. I don't notice any swelling on either side. Temperature, moisture looks good. I'm going to look at her capillary refill on her toes, and I'm going to be doing them on both sides, and her capillary refill is brisk. So you got good circulation down here.
Okay.
We already saw her walking, so we know she's strong enough to walk, but I could ask her at the end of the bed here to press on my hand to test her strength, and then also to pull up on her toes. Pull up on your toes now. And can you pull up on this one more? Yeah. For a minute there, it felt like this was a little bit less, so I wanted to make sure. Okay. And then, can you feel my hand?
Yeah.
On your legs? Does it feel equal on both sides?
Yeah.
Okay. I can also then, while I'm here, check and see if I could find her. You can just relax your leg.
Okay.
Check and see if I could find her popliteal pulse, which is not the easiest thing in the world. Wow, I think I have it. But even if I couldn't feel it, I would notice her pedal pulse is here on the top of her foot, which is strong. And I can also see that she doesn't have any swelling. Her color is good. Her temperature is good. She's got good capillary refill, so I'm not worried about her blood flow. And then I'll get her posterior tibialis here, right underneath that malleus. And that's good. And then I would do that on both sides. Okay. All right, now if I hadn't seen her walk, or if she was bedridden or had difficulty getting up, I might ask her if she could raise her leg up off the bed, if she could bend her knee, either one of those things, and do that both ways for range of motion, just like I asked about her arms. Okay. All right, I'm going to help you sit up. Okay. Now, after I touch people's feet, then I kind of like to change my gloves. Okay. They're moving good. Right. And then, excuse me, wash my hands and put on another pair of gloves, just in case there's anything else left I have to do. Let's see, what else? Oh, I know something I forgot. I forgot while I was on her back to check her chest excursion. Oh, don't you just hate putting gloves on when your hands are wet?
Yeah, it's hard.
I'm sorry. Should have done it before, then I wouldn't have to put the second pair of gloves on. Okay, so if I'm checking her chest excursion, then I want to see that she's breathing equally bilaterally, and this is another way to do it. So some people put their hands apart like this. I kind of like to put my fingertips together, right sort of down towards the base of the lungs, and ask people to take a deep breath. And one more time, deeper. And I'm looking for that little bit of movement from the thumbs, and I want to feel that the chest is expanding equally on both sides. And it is. Let's see. What else? Okay. I did her eyes. I forgot to say something about her. I did say Perla, but her, when I was doing it, I did look at her mucous membranes, but her sclera is white. Did range of motion. Did lymph nodes. Did all the pulses. Did the chest sounds. Did the breathing. Did her range of motion. Did her bruise or lack thereof. Did her abdomen. did skin assessment all over, moisture, color, tinting, temperature, capillary refill. Okay, I think that's it. So then when you're finished, what we'll let you do is take a look at your checklist, just briefly, so you could run down it to see if you forgot anything. Okay, so I'm going to run down my checklist. Really cute. I did her general survey. She was answering me correctly. I forgot to mention posture. I have to go back and do that. Grooming. Okay. All right, Dr. Ritchie, I think I'm done. Oh, I think with your eyes, no, the sclera was white and the cornea was clear. I forgot to say that. Do you have any questions for me?
No.
Okay.
Very
Well,
thorough.
I'm just gonna let you sit here. You have a call bell if you need it,
Okay.
and I will go out and just in a couple seconds, somebody else will be back in to take you for the rest of your checkup. Okay. All right. So that is my physical assessment checkoff. Now, the thing about your assessment checkoff is if you miss something in an area, for example, over the years I've done it, sometimes I've had people who don't know all the heart locations, or one year I had somebody who forgot to check the breath sounds on the back, did everything else. Sometimes people forget the whisper test. You've probably had people forget things too, forget to do the bruies or whatever. When you go back for remediation, you go back and practice it, you only have to do it on that one area. So when you check off again, you'll check it. If I check you off and you have to do it a second time, Ms. Ritchie might check you off, but you only have to do it on the body system that you missed. Okay. All right. Anything else?
No, I think that's it.
Okay. All right. Thank you very much. Good